Imagine walking into like a luxury clinic in South Korea, paying something to the tune of $2,000, and having a vial of what scientists literally use to consider cellular garbage injected into your most intimate tissues.
Yeah, it sounds like science fiction, honestly.
Right. And the glossy brochures in the waiting room are promising you that this procedure will, reverse aging, cure chronic pain, restore elasticity.
All the buzzwords.
Exactly. But then, meanwhile, the US FDA is warning that this exact same procedure could trigger a lethal immune response. So we have to ask, who is actually telling the truth here?
It is arguably one of the most volatile intersections of cutting-edge biology and just pure commercial opportunism that we're seeing in medicine today.
It really is. So today we are asking a very specific question for this deep dive. Is female intimate exosome therapy actually safe?
It's a huge topic.
It is. We're getting into this because you might be seeing targeted ads for it or, reading about it in wellness forums, and the claims being made are just nothing short of wild.
Oh, absolutely. The hype is everywhere.
So, to figure out what is real, we pulled together a massive stack of sources for you. We're looking at official regulatory warnings from the US FDA and the UK's MHRA.
Which are pretty heavy reading, I have to say.
Definitely. We've also got global clinical guidelines, peer-reviewed preclinical studies, including this really highly detailed porcine study out of Duke University. And we are contrasting all of that with the promotional materials currently being pumped out by international medical tourism hubs.
The contrast in those materials is just staggering, honestly. You have the incredibly strict, cautious language of global regulators sitting directly next to holiday packages, promising intimate rejuvenation.
It's jarring. So our mission for this deep dive is to basically separate the biological promise from the regulatory reality. We want to give you the objective mechanistic facts so you can navigate this hype without having to blindly trust a clinic's marketing or, panic at a regulatory warning.
Right, giving you the actual science.
Exactly. Okay, let's unpack this. Because before we can even touch on the safety of injecting these therapies, we kind of need to understand the mechanism.
Yeah, what actually is an exosome?
Right. Clinics are hailing them as a miracle, but for a long time, the scientific community literally thought these were just the trash cans of the cell.
They did. I mean, for decades, when researchers looked at cells under an electron microscope, they saw these tiny particles being ejected and just assumed the cell was simply offloading waste.
Like taking out the garbage.
Exactly. But we now know those particles are called extracellular vesicles. And their function is entirely different.
They're actually nanoparticles, right?
Yes, microscopic nanoparticles released by almost every cell in your body. But rather than carrying trash, they are carrying highly specific payloads of proteins, lipids, and genetic material, particularly messenger RNA.
Which is huge. And we should probably clarify the difference between an exosome and a stem cell here, because the marketing often conflates the two.
Oh, constantly. They use the terms interchangeably, and they really shouldn't.
Right. But since you're listening and following the regenerative medicine space, you likely already know that a stem cell is a living entity. It has a nucleus, it divides, it replicates, and it differentiates.
Which exosomes do not do.
Exactly. Because exosomes are not living cells, they cannot self-replicate. And that basically eliminates the specific danger you get with live stem cells, which is the risk of the cells multiplying out of control and forming teratomas, or tumors.
That lack of a nucleus changes the entire risk profile, really. And it also changes the mechanism of action. Because it can't rebuild tissue itself, the exosome has to find a way to instruct the existing cells in the patient's body to do the work.
I always think of the exosome less like, a microscopic FedEx package dropping off supplies and more like a software update on a USB drive.
Oh, I like that analogy.
Yeah, because the exosome has this lipid outer layer, a fat layer, which is very similar to the membrane of the cells in your body. So when the exosome bumps into a target cell, those two fat layers merge, almost like two soap bubbles fusing together in the air.
Right, they just blend into one another.
Exactly. And that fusion allows the exosome to dump its software, the messenger RNA, directly into the target cell's cytoplasm.
That is a highly accurate way to visualize it, actually, because once that mRNA is inside the target cell, the cell's own ribosomes read that genetic code, and they just start synthesizing new proteins based on those instructions.
He's literally reprogramming the cell.
It essentially reprograms an aging or dormant cell to behave like a younger, more active cell. So the instructions might tell the cell to upregulate collagen production or stimulate angiogenesis, which is the formation of new blood vessels, or just dial down the inflammatory cascade entirely.
Which perfectly brings us to the specific application in female intimate health. Because, as a woman goes through menopause or experiences severe pelvic trauma during childbirth, the drop in estrogen essentially starves the pelvic and vaginal tissues of vascularity.
Yes, the blood flow decreases significantly.
Right, the tissue thins out and it just loses its structural integrity.
And the physical manifestation of that cellular starvation is severe. I mean, the sources detail the conditions these clinics are targeting. Vaginal atrophy, dyspareunia, which is the medical term for intensely painful intercourse, and highly complex autoimmune conditions like lichen sclerosis.
Which causes chronic, painful inflammation of the vulvar skin, right?
Exactly. And when tissue loses its blood supply and its collagen matrix, the impact on a patient's daily quality of life is just profound.
It's debilitating. So the theory is that if you flood that starved tissue with concentrated exosomes, you are delivering millions of these software updates, telling the local fibroblasts to wake up and rebuild the vascular networks.
That's the exact biological promise they're selling.
And the literature shows this isn't just purely theoretical, which is wild. Like the preclinical study we pulled from Duke University provides an incredible look at the actual mechanism of healing.
Yeah, the Duke study is fascinating. They were researching vaginal mesh complications.
Right, which is a major issue in urogynecology. Synthetic mesh is frequently used to surgically support pelvic organs in cases of prolapse. But a notoriously difficult complication happens when the vaginal tissue overlying that mesh breaks down, leaving the synthetic mesh exposed.
Which is incredibly hard to treat. The surrounding tissue is often way too compromised to heal over the foreign object.
Yeah, usually necessitating complex, repeated surgeries just to remove the mesh entirely.
It's a nightmare scenario for patients.
So the researchers at Duke used a porcine model pigs because their pelvic anatomy really closely mirrors human tissue, and they created these vaginal mesh exposures. But instead of performing a secondary surgical closure, they simply injected exosomes directly into the compromised tissue surrounding the exposed mesh.
Just exosomes,
Yeah.
no extra surgery.
With the injections.
And the histological findings, what they saw when they looked at the tissue under a microscope afterward, were remarkable. The exosomes reprogrammed the local cells so effectively that healthy, fully vascularized tissue regenerated completely over the synthetic mesh.
Over a synthetic object. That's incredible.
It is. They found thick, rugae-rich mucosa. And rugae are the natural folds in vaginal tissue that allow for expansion and elasticity.
Which is exactly what you want.
Exactly. Not only did the tissue grow back, but it did so with significantly less fibrosis or scar tissue than a typical surgical repair would trigger.
Okay, so it is undeniably an incredible biological promise. I mean, just delivering the right biochemical instructions allowed a living organism to rapidly heal over a synthetic foreign body.
The potential is massive.
But patients in pain, they don't want to wait for a 10-year clinical trial to finish. If we have a mechanism that can regenerate tissue so effectively without the tumor risks associated with live stem cells, the obvious question is why your local gynecologist isn't offering this alongside standard treatments.
Right. Why isn't this everywhere?
Exactly. And that gap between a controlled lab setting and commercial application brings us to the global regulatory hammer.
Oh, the regulatory hammer is heavy here. The scientific potential is running light years ahead of the legal and manufacturing reality.
Let's look at the regulatory landscape, starting with the United States.
Okay, so the FDA stance is unequivocal. They have 0 approved exosome products for any regenerative, aesthetic, or intimate health treatments. 0.
None. The FDA consumer alerts classify these specific products as biologic drugs. That means they do not view exosomes as just some simple cosmetic additive.
Not at all.
Regulators demand the exact same stringent, multi-phase clinical trials that would be required for a new pharmaceutical heart medication or like a chemotherapy drug.
And in the United Kingdom and the European Union, the legal framework is just as restrictive. Human-derived exosomes are classified under the Advanced Therapy Medicinal Products Regulation, the ATMP.
But it's just a very high bar to clear.
Very high.
Yeah.
The UK's MHRA, the Medicines and Healthcare Products Regulatory Agency, strictly prohibits the injection of these products outside of an authorized clinical trial.
The scientific community's alarm over this is captured perfectly by Dr. James Edgar. He's a cell biologist at the University of Cambridge. In the sources we reviewed, he literally stated he is appalled and shocked by the commercial use of these therapies.
Those are strong words from a researcher.
Very. His exact quote reads, "These are human biologics and there's a risk for disease transmission. It's not in the public's interest of safety to have this stuff washing around."
Washing around, wow.
And the ban extends beyond just injections. Mr. Tunk Tiryaki, a consultant plastic surgeon, clarified that even the topical application of human-derived exosomes is explicitly banned in the UK Cosmetics Database, CUESing.
So you can't even rub it on the skin legally.
Nope. And I want to push back on Dr. Edgar's specific phrasing here we just established mechanistically, that exosomes lack a nucleus. They cannot self-replicate.
Right, they aren't live.
So if they aren't living cells, why are regulators treating them like a live virus? Where does this risk of, quote, disease transmission come from if the exosome is just an inert package of messenger RNA?
That is the million-dollar question. And the risk does not necessarily stem from the exosome itself, but from the massive bottleneck in commercial manufacturing.
Ah, the supply chain.
Exactly. You have to consider how these exosomes are obtained. They are harvested from human tissue, predominantly donated umbilical cord, Wharton's jelly, or adipose fat cells.
So actual human source material.
Yes. And once you have that raw human tissue in a bioreactor, you have to separate the microscopic exosomes from the living cells, the chemical culture media used to grow them, and all the cellular debris left behind.
Meaning the purification process.
The purification process is everything. The industry standard involves ultracentrifugation, spinning the material at incredibly high speeds to separate particles by density.
Okay, sounds scientific enough.
It does, but however, in the commercial aesthetic space, there are currently no universally enforced manufacturing standards for this purification. It is incredibly difficult to isolate purely exosomes.
Meaning a patient thinks they're getting a pure, targeted software update, but they might actually be getting like a highly contaminated biological soup.
A biological soup that carries immense immunological danger.
Right.
Yes. Because if a commercial lab's purification process is subpar, the final vial might contain endotoxins.
And what exactly is an endotoxin in this context?
Endotoxins are lipopolysaccharides found in the outer membrane of certain bacteria. Basically, if the lab environment isn't perfectly sterile, these bacterial cell wall fragments end up in the exosome vial.
Yikes. And injecting bacterial fragments directly into highly vascularized intimate tissue, I mean, that is going to trigger an immediate massive immune response.
Oh, absolutely. The immune system detects the endotoxins and just assumes a systemic bacterial infection is occurring. This can trigger severe allergic reactions, peaking at anaphylaxis.
Which is life-threatening.
Completely. It's a systemic response where blood pressure plummets and the airways constrict. But even without bacterial contamination, just injecting poorly purified human biologics that contain foreign cellular debris from another person that forces the patient's immune system to attack the injection site.
Which totally makes sense. Regulators basically view it as playing Russian roulette with the patient's immune system because you just have no way to verify what is actually in the vial.
Exactly. You're flying blind.
But this strict regulatory blockade has triggered a massive, highly predictable cause and effect reaction in the market.
As it always does.
Right. Because patients with conditions like severe dyspareunia are desperate for relief. And since they cannot access these therapies legally in the US or UK, an entirely unregulated international medical tourism industry has exploded to fill the vacuum.
Market demand will always find a supply. Always. Patients are routinely flying thousands of miles outside of their home regulators' jurisdictions just to bypass the FDA and MHRA bans.
And the marketing driving this tourism is incredibly seductive. We actually pulled analytics from Bookiemed, which is a major international medical tourism platform, just to see what a patient searching for relief encounters online.
What does it look like?
It's intense. Turkey has positioned itself as a global hub, performing over 5,000 of these specific intimate rejuvenation procedures annually. The pricing starts at roughly $1,800, which is just a fraction of what experimental out-of-pocket biologics cost stateside.
So it's cheap and accessible.
Very. And the platform features these glossy promotional videos for luxury clinics in Gangnam, South Korea, integrating exosomes with high-tech lasers. You can even book treatments at the Crete Fertility Center in Greece, which is perfectly packaged as like a rejuvenating holiday by the Mediterranean.
The optics are perfectly designed. They blend the luxury of a spa vacation with the authority of cutting-edge science. But coupling experimental biologics with international travel introduces massive compound risks.
Oh, for sure.
Actually, the British Association of Aesthetic Plastic Surgeons, BAPS, Alongside the Bariatric Surgeons Association, BAWMANS, they issued an unprecedented joint statement specifically to counter this tourism narrative.
They felt they had to step in.
They did. They wanted to outline the physical traps patients are falling into.
Yeah, the BAMIAS and BOMS statement highlights just absolute systemic failures in the tourism model. First is the near total lack of preoperative assessment.
Right, you just show up.
Exactly. A patient flies in, receives an injection or surgical manipulation from a team whose credentials cannot be easily verified, and then leaves shortly after. But the most immediate danger they flag for pelvic procedures is the compounding risk of deep vein thrombosis.
DVT is terrifying in this context. The mechanics of travel directly antagonize the body's healing process. Injecting or surgically altering pelvic tissue causes localized trauma and inflammation.
Naturally.
If a patient then boards a long-haul flight, sitting completely immobile in a pressurized cabin for 8 to 12 hours, the blood pools in the lower extremities.
Wow, okay.
Yeah, so the combination of pelvic tissue trauma and immobility creates a perfect storm for blood clots. If a clot breaks loose and travels to the lungs, it causes a pulmonary embolism, which is frequently fatal.
That is so scary. It is essentially buying a highly complex, potentially buggy piece of experimental technology abroad with zero warranty. Like, if the technology fails, the manufacturer is 5,000 miles away.
You're entirely on your own.
We saw this in the surgical literature we reviewed. It documents severe complications from botched intimate procedures, including the formation of rectovaginal fistulas.
Which is horrific.
It really is. A fistula is an unnatural, surgically created connection between the rectum and the vagina. If a patient develops a complication of that magnitude after returning home, resolving it becomes an absolute nightmare.
Because your local healthcare system has to manage the fallout. An emergency room physician in London or New York is going to have no verifiable record of the exact formulation, the purification level, or the origin of the human biologic that was injected into you in a foreign clinic.
They're treating you completely blind.
Yes, exactly. Treating a severe infection or necrotic tissue response without knowing the causative agent complicates the medical intervention significantly.
Okay, so we have looked at the profound biological potential of the mRNA mechanism, the strict legal barriers, and the extreme length the patients will go to access these treatments. But we need to contextualize this for you, listening, who isn't searching for some biohacking miracle, but simply wants safe clinical relief from conditions like vaginal atrophy.
Right, the practical application.
Yeah. If exosomes are off the table legally, what alternatives are they being offered, and how do the safety profiles actually compare?
This is the core dilemma driving the entire market right now. If a patient seeks non-hormonal treatment for dyspareunia in a highly regulated market, clinicians frequently pivot to energy-based devices.
Like lasers.
Yes, these utilize either fractional CO2 lasers or radiofrequency energy, inserted vaginally, to alter the tissue. Interestingly, a lot of the international medical tourism clinics also pair their exosome injections directly with these lasers.
Right, they claim the laser, preps the tissue for the exosomes.
That's the marketing, yes.
But we really need to look closely at the mechanism of those energy devices, because a CO2 laser is not gently delivering a software update. It is using thermal energy to vaporize columns of tissue, creating hundreds of microscopic burns.
It sounds brutal when you describe it accurately.
It does. The goal is to induce a state of localized trauma, basically tricking the body's immune system into launching a fibroblast cascade to flood the burned area with new collagen as it attempts to heal the thermal damage.
The mechanism relies entirely on forcing a repair response through destruction. And while clinics market these lasers as standard, safe alternatives to biologics, an objective look at the regulatory data reveals massive red flags there too.
Absolutely. The FDA actually issued a severe safety communication regarding these specific energy-based devices. They explicitly warned that using lasers for vaginal rejuvenation can cause severe vaginal burns, extensive scarring, and chronic debilitating pain.
So it can actually make the problem worse.
Yeah, the tissue damage can actually worsen the very dyspareunia the patient is trying to treat in the first place.
And the clinical guidelines across the board echo that hesitation. In the UK, the National Institute for Health and Care Excellence, Nice Juice, issued guidance warning that the long-term safety evidence for vaginal lasers remains inadequate.
And didn't ACOG have something to say about this too?
Yes, the American College of Obstetricians and Gynecologists went a step further, formally stating that these laser procedures are not medically indicated.
So what does this all mean? This synthesizes the impossible situation patients find themselves in. On one side of the scale, exosomes offer a scientifically elegant mechanism. By delivering mRNA instructions directly to the cells, you theoretically bypass the need to burn or traumatize the tissue, and you avoid the tumor risks of live stem cells.
It sounds perfect on paper. But on the other side of the scale, the complete lack of manufacturing standardization turns that elegant science into an immunological gamble. A patient has no way of knowing if they are receiving pure messenger RNA or a vial contaminated with bacterial endotoxins that could trigger anaphylaxis.
Right. So for you listening, navigating this space requires extreme vigilance. If you are browsing an aesthetic clinic's website, whether it's local or abroad, and you see marketing claims that their injected human exosome therapies are FDA cleared, fully approved, or 100% risk-free, you now possess the mechanistic knowledge to spot the deception.
Knowledge is the ultimate protective measure here, really. I mean, the FDA has approved 0 exosome products. The MHRA actively bans their injection. Any practitioner claiming otherwise is either dangerously misinformed about the products they're injecting, or they are actively obfuscating the legal reality just to secure a sale.
Yeah. Wow. Well, thank you for joining us on this deep dive. We've traversed an incredibly complex, rapidly shifting frontier of regenerative medicine today. I mean, the collision of brilliant biological mechanisms, rigid legal frameworks, and aggressive international commerce makes female intimate exosome therapy a true minefield for the consumer.
It absolutely demands that patients maintain an uncompromising standard of skepticism when evaluating medical marketing.
For sure. But before we sign off, there is one final provocative concept from the literature to consider on your own. We spent this time examining how the mRNA payload within an exosome acts as a set of instructions, right? Telling a body's cells to wake up, build new blood vessels, and rapidly multiply to repair tissue.
The biological blueprints for rapid cellular proliferation.
Exactly. But consider what happens if those exact grow and multiply instructions, delivered in a massive concentrated dose via injection, are accidentally absorbed by a silent, undetected precancerous cell hiding within that intimate tissue.
It is a profound biological variable.
It is. The scientific literature quietly acknowledges this unknown at the very end of several preclinical studies. The long-term effects of repeated exosome administration on cell proliferation are entirely undocumented. By flooding the tissue with instructions to grow, we cannot yet guarantee we are only commanding the healthy cells. Something to think about. Keep asking the hard questions, look past the glossy brochures, and stay insanely curious. We'll catch you on the next one.